Hi everyone, welcome back to the channel. My name is Drew. I'm an exercise physiologist and Chinese medicine practitioner, and I love teaching yoga and qigong, pranayama, breath work in conjunction with exercise physiology and rehabilitation. So kind of blending the modern with the old. And in today's video we're looking at different sitting postures, and we're going to start with kneeling posture, or Virasana in the yoga world. And I really love this posture because it's great for your posture. And we are using the app Muscle and Motion. We're in the yoga app, and we're in Asana. And in the Asana section here, we're looking at the hero pose. So you can find that. If you want to join along, definitely go and get yourself a subscription to the app. They do great work. So one reason I love this posture here is kneeling is because it expresses a full range of movement of the knee joint and the ankle joint. And when you can attain this posture, you can then align your spine, your vertebral column, and your pelvis in a very neutral position. So it's great to do breathing exercise with, breathing practices and meditation. Of course, you're going to get a lot of compression in the knee, and for beginners it's very uncomfortable, and your legs will go to sleep if you sit here for a long period of time until you get used to it. So you've got to allow that to happen. So I thought we'd just kind of break down some of the key aspects of sitting in kneeling and the benefits of why we're doing it. So one of the key things you'll see here is from the front is that, actually if we come back to the side, here we have your heel bone. This is the calcaneus, and we're sitting on the ischial tuberosities, which is called the sit bones. So ideally what you want to be able to do is align your sit bones if you want good neutral posture, to be kind of sitting on these bones, and that will kind of align your pelvis in a slight anterior tilt, which will then create the neutral lumbar lordosis and thoracic kyphosis, like the normal curves of the spine. You can do this position in a few different ways. So in this example, the calcaneus is here is kind of lateral to the pelvis there, and this bone here, that is the femur. So essentially what you're doing is you're seeing your heel on the outside of the femur. This is the head of the femur there, the greater trochanter. So you're sitting on the outside of that. There's another technique you can do where you can kind of sit your sit bones on your heels. So you're going to be more, bit more narrow in the stance with the leg position. If you come to the front, you'll see how they're angled out like this. Now when you sit like this with the heels on the outside, you're going to create a little bit of torque or a bit of twisting in the knee, and for some people that can be really uncomfortable, particularly if they've had knee problems. So the version of this posture that I personally prefer is where you sit more, your calcaneus, your heel bones are sitting kind of underneath your sit bones. It will lift you up a little bit higher. You'll be able to get a bit more of a neutral pelvis as well, and it's just a bit more comfortable on the front of the knee, so you're not getting that twist in the front of the knee. So if we kind of skip to the next video, and as always there's lots of different kind of videos in this app. I'm not going to go through them all. I want you guys to go out and get a copy for your own learning, but if we try to jump to this one, this is a good example of what we're talking about here. So when you're kneeling, the femur is going to be orientated in this direction, and the tibia is directly stacked up right underneath it. So you have to have full knee bends. That's full knee flexion. So that's kind of one thing there. And you can see that the heel, the calcaneus, is sitting directly underneath the femur there, the head of the trochanter. So it's a little bit more aligned. Now if we keep playing the video, you'll see it'll rotate. So if you take your feet outside, what happens is that the femur has to rotate internally, so it turns in. Okay. So you'll see that the head of the humerus here lifts up, and so then you can kind of get some impingement in the acetabulum here, where the neck of the femur kind of connects into the rim of the acetabulum on the pelvis. But at the same time, you're going to get this internal rotation, so the femur's rolling inward, and then the tibia underneath it, to compensate, is going to have to roll inward as well, or go internally rotation this way. So you get double internal rotation. And you can see here, this is your ACL, anterior cruciate ligament, and one behind is your posterior cruciate ligament. And then you're also going to have here your lateral collateral ligament. So this ligament here is going to get stretched. Okay. And on the inside, the medial compartment of the knee is going to get compressed. So you're going to stretch out this lateral ligament, and you're going to compress the connective tissue and the cartilage on the medial aspect of the joint. So you can see how it's kind of getting jammed here. So that's going to create a lot of issues for people in terms of their knee joint. And so when you sit in this kind of, like, sometimes it's called a W shape. When you sit in this shape, you essentially create this unstable knee joint, because you're stretching one ligament on the outside and you're compressing the other side in. And personally, I don't like it very much because of that instability that's going to create. So the workaround for that is to bring your heel, your calcaneus, and kind of tuck it under, so you're sitting more on the glute max or under the actual sit bone here. So here we've got, you can see that nice aligned position. So calcaneus underneath the femur, or calcaneus underneath the sit bone. And you can just orientate your knees out a little wider if you need to. Okay. Otherwise, you're going to get in a situation where the knees are going to roll outward, or create internal rotation of the femur and then internal rotation of the tibia to compensate. So you've got a flat position to rest on. And then there's another version of this, actually, where then you point the toes outward like that. And what that's going to do is going to go put the tibia into external rotation, then it's going to stretch the other side of the ligament. And if you've already got that natural flexibility in the knee, that's fine, but I wouldn't recommend trying to attain this kind of flexibility, because you're just going to create an unstable knee joint. And particularly these ligaments, you don't want to be stretching these ligaments. You want them nice and strong and tight, because their job is to keep the knee bones in the right position. So everything's a bit of a trade-off, a bit of a plus minus. Now, this is just a nice demonstration here. So in the normative sitting position, the pelvis is slightly rotated forward. So you can see here you got a slight anterior rotation, okay, which creates that nice lumbar arch there. Okay. So here you can see the calcaneus is sitting just outside of the femur. Whereas I would sit more underneath the sit bone here. Quadriceps stretch with the hip flexors, except for the rectus femoris. So here we get a really good quad stretch. Okay, you're not really getting a hip flexor stretch here at all. The psoas and the iliacus are going to be fairly passive, so you're not really getting a stretch there. And the inner erector spinae stabilize the spine. So all your multifidi are going to be working to stabilize the spine. And the head is going to sit just on top of your C1, C2 atlas there. So it's great to encourage posture. Come back. It's also great because you're going to stretch the tibialis anterior and the anterior compartment. So that's extensor digitorum longus, extensor hallucis. So basically the front shin muscles. Okay, you can see them here. So the big toe muscle here is extensor hallucis. Then you've got extensor digitorum, which divides into the four toes. So often a lot of shin splints, kind of compartment syndrome kind of issues are as a result of tight shin muscles. So this compartment here. So the simple fix is just to learn how to kneel onto your shins. And if you can do this, you've got full plantar flexion of the ankle, means that's full stretch. So when you're in this kneeling seated posture, you've got full stretch of the shin muscles. It's really important. Here we can see the posterior muscles, the multifidi, these ones that kind of thread up and down the spine. And we can see the lobes of the lungs. and then the bigger multi-thigh muscles here. So they're your postural muscles. So common problems. Let's have a look at some of these problems. Okay. So if you've got tight quads, okay, short and quadricep muscles, what'll happen is that you'll have to sit up high like that. Now I've worked with clients before, like their quads are so tight that essentially when they kneel down, it looks like, if you take away the pillow, it looks like that. They can't actually get their butt onto their heels because the quads are so tight they're holding them up. So one way you address that, if your quads are that tight, you're going to need to do a lot of quad strengthening with an eccentric focus. So things like lunges, things like squats, heel elevated squats particularly, where you go and slowly work down into depth, and then lots of stretching to help encourage that. Okay, because you need that quadricep to be longer. As a general rule, I like all my clients to be able to get down to full kneeling because it tells me that their quads have full knee range of movement. Okay, so it's just one of those kind of simple little assessments I run people through. Assuming too that they have any like joint issues like degenerative changes in the knee, arthritis, or some kind of cartilage issue where it stops them from actually weight bearing down onto the knee. But one simple fix is if people are really quite tight in the quads, what we can do is you get them into a bolster or a pillow, get them sitting on the bolster, okay, till they feel the quad stretch. And then gradually over time, you just get a smaller and smaller pillow or bolster or yoga block and bring it closer down to the heels until they can get down to that position. Okay, and that's very achievable, that's very doable. So tight quads is one issue. Next issue is that tight tib anterior. So here, if you have tight shin muscles, it basically creates dorsiflexion on the ankle, so you have a restricted range of movement in the ankle, and that can be a problem because that can create things like a foot drop or where you catch your toes, you're not clearing the foot properly when you're walking, and so you can kind of have these balance issues because these muscles here are too tight. Okay, so the simple fix again is just to kneel down onto them in kneeling, and then you can get that nice shin tibialis anterior stretch. Alright, so kneeling, you can get that double stretch here. So you can see from this position, really tight, and this is another assessment I do with clients, is get them to kneel down. Okay, and if you see this huge space here between the shin and the floor, we know that they've got tight shin muscles. We need to work on that because it'll be lifted up. Okay, so we want the lifting up, and then the fix is you just get a roll-up towel or a bolster. You just put them under the ankle where the ankle crease is. Get them to sit back down into kneeling, and same with the bolster under the pelvis for the quads. You just gradually make it smaller until they can get all the way down into that kneeling position. Okay, so quite a simple fix. It just needs to be patient. Do it progressively. It's going to be really uncomfortable. You're going to get a lot of compression here. Often when people are starting, their feet will go to sleep or they'll get numbness and tingling because you're restricting the blood flow through this region. It's really normal. Just listen to your body go slowly, and over time you can work on that position there. And you can see here the different angle in the calcaneus as well. So as you bring your feet down into a nice shin stretch, the position of the calcaneus changes. Okay. So that's going to affect your foot mechanics and your walking mechanics a lot if you have really tight shin splints. So when I'm working with people who've had shin splints, I've had shin splints before, which turned into stress fractures. I wish people had shown me these simple stretches. It would have saved me a lot of pain and discomfort in the past. But quite a simple fix. So you just do these stretches, maybe some self-myofascial release, and then of course we want a muscle that's also strong. So then you can do tib anterior raises as well to get that muscle nice and strong. So super important. And then Next common problem. Okay, we have that sensitivity in the knee. When we come back into this angle here, if you've got any structural problems in the knee, any arthritis, any kind of meniscus irritation, any ligamentous problems, any bursitis, tendonitis, Baker's cyst, anything in the knee, when you're kneeling like this and then you take your heels out wide, you're going to compress it and you're going to irritate it. Okay, so it's not going to be a fun time. So I am not a big fan of kneeling with the heels out. You can see how the calcaneus is out wide there. You're just going to irritate hip joint and you're going to irritate the knee joint. So the simple fix, if we come back to our previous one, is to sit, okay, with your heels underneath your sit bones here. So if we get the right angle, we'll come back. Let's have a look. You might hear some snoring in the background. It's my little stuffy dog having a sleep, and she snores when she sleeps. Here, so we want this calcaneus sitting underneath the ischial tuberosity. Alright, so when you get that, you can actually feel you're sitting on that sit bone there. Okay, that's what you want. Okay, nice aligned femur and tibia, they're not out to the side, and that's going to create a nice healthy knee joint for you. Okay, other common problem is the sitting posture is maintaining neutral curve here. So you'll see if someone's got a really tight lower back, okay, tight hip flexors, that's going to create this anterior rotation, anterior tilt. We want normal, there's some normal anterior tilt. Okay. So it's going to be a combination of, if you've got tight quads, tight shins, and your hip flexors are tight, it's going, if you try to kneel down, it's going to create this arch in lower back. And the simple fix for that is to, again, come up onto a bolster, and so you can come back into more of a neutral position here. See, this position I don't like, because it's, again, the foot's going to be out wide. I would bring the heel underneath the sit bone or underneath the glutes. That's just a personal thing for me. I have actually torn my medial collateral ligament and did a bucket tear in the meniscus on my left leg. And sitting like this whilst I'm rehabbing, I could definitely notice a difference. If I had the heels out wide, it was incredibly painful on the knee, but sitting more neutral position, much better for the knee. So I recommend that for the clients who I'm working with. But some people, it's also a slight variation in pelvic position, because women, for example, tend to have a wider pelvis. They can typically bring their feet out a little wider. It might be more comfortable for them. So there is that little bit of individual variation. What you don't want is the twisting of the knee like that. You want to stack the knee and the femur quite nicely. So again, the solution is just to bring your pelvis up a little bit higher, so you can find a more of a neutral position here. Okay. Now, if you have tight hip flexors, typically tight hip flexors create this anterior rotation. But in some instances, as you're coming down here, it's going to, you can imagine the hip flexors are kind of coming down this direction. If they're really tight, if you go too low in this position, it actually rolls the pelvis back the other way, and that kind of makes people slouch. Okay, so you'll kind of round out your back a fair bit. So tight hip flexors in a kneeling position can actually make people posterior tuck their pelvis, or anterior tuck the pelvis. It just depends how they compensate for it. So just watch out for that if you're teaching students. And then we come into the other one. Common postural problem is really tight chest muscles. Okay, so anytime you're trying to like align the spine in a seated posture, if the pecs are tight, it's going to pull the whole shoulder blade complex forward. So the scapula and the humerus is going to come forward. And this is just a couple of, so I'll leave that for you to jump in and check that out at your own time. There are different solutions I have for that. Again, I don't want to show a whole app. You've got to go in and support the app. But chest, big problem for a lot of folks nowadays, because everyone's sitting so much, and slightly head forward posture, slightly upper back rounded posture. and then you create that issue there. So you want to stretch the upper back, stretch the chest, and you want to strengthen with back extensions and rows and pulls, and just being really aware of your posture, and you can kind of create that alignment issue. Good. And let's just look at some of these preparatory exercises. So here we've got boat pose. This is a pretty intense stretch. So you're going to get that full quad stretch here, particularly the rectus femoris. You're going to be pulling back the feet into plantar flexion. So you're going to get a huge shin stretch. So what you can do is start in 3 different positions. So position 1 is here. So you lie down and you grab the feet, and then you pull the hip bone down to your butt. So that's stretch position number 1. For some people, they can't even reach their feet, so then you'll need to kind of select a different posture for that. Then stretch position number 2 is then you lift your chest up a little bit. Okay, good. That's going to get a nice ab stretch. You're going to start to stretch out the chest muscles. To lift your chest up, you have to pull your feet down, and so you're going to get that quad stretch kicking in. And typically you'll come up onto the base of the rib cage here, which is a nice place to go, about there. Okay, and then the third kind of stage is then you push your feet away. You resist with your arms, and that gives you an incredibly deep stretch in the chest, in the biceps, in the anterior deltoid, shin stretch, quad stretch, ab stretch. So the whole front line you're getting stretched out. Okay. And depending on people's lower back, you're going to get quite a strong, deep back bend here. You're going to get a lot of compression in the lower back. So it just depends on people's backs and how they respond to that as well. But in terms of stretching, okay, amazing way to prepare for kneeling. So shin, quad, or rec fem. Bit of hip flexor. It's not the ideal position to stretch hip flexor, so like psoas iliacus, you will get some. You're going to get rectus abdominis, pec major, deltoids, bicep. So it's a great compound stretch. Lower back muscles will be incredibly active. Glute muscles will be active here. So it's great for the lower back if done correctly, like any exercise. There's always a technical issue with it. Okay, so that's a bit of a review on kneeling posture. Okay, quick little summary. My personal preference is to have the calcaneus, the heel bones, more underneath in line with the femur. So having the heel bone kind of sitting on the outside of your pelvic bone, the ischium here, or right on top of it. It just depends on your kind of a unique anatomy of the pelvis. You might even have your knees a little bit more out wider. That's typically better for men as well, to have more of a wider knee stance. But then the femur and the tibia are still stacked on top of each other. For women who have a slightly wider pelvis, they might be able to have a bit more of a wider kind of stance here. But the issue is you can see that the line of the tibia versus the femur, you're going to get that twisting in the knee. So that can create issues in the knee joint and create a little bit of instability. So my personal preference is to line those two up. Then you get full knee bend, so full knee flexion, full plantar flexion. So great ankle range of movement, great knee range of movement. You're going to get quad stretch, shin stretch. You're aligning your pelvis in neutral position. This is going to allow you to breathe correctly. So when you're doing seated breath work, pranayama, qigong, you can do your breathing techniques correctly. You can really get into the pelvic floor in this position. So here you can really open up the pelvic floor. Okay, easy to adjust by just sitting on a bolster, lifting the height up, and you can really train people's posture because you're using all these postural stabilizer muscles. Okay, nice neutral spine in the head, eyes forward, chin slightly tucked. You can really work on developing great posture. Okay, and so it's a fundamental movement pattern, which I think is highly worth spending a lot of time on. And it's just something you can do when you're watching a bit of Netflix in the evening. Yeah, you can see that angle there. That's why I don't like it. Just practicing, just getting down on the floor for 5 minutes. Okay, okay, and slowly over time building it up. And your leg will go to sleep. You know, I've done kneeling meditations where I've been in this posture for 45 minutes, come out of it, legs asleep, but you just give it a couple minutes and circulation returns and it's fine. Okay. But just go easy, listen to your body, and just develop that practice. Okay. So thank you very much for watching. If you have any questions, please feel free to drop a comment in the comments below, and would really appreciate it if you give a like and subscribe to support the channel. And in the next video we'll look at sitting cross-legged postures. Okay, but much more complicated because you're getting a little more rotation in the femurs and things like that as well. So we'll look at that. Okay, whatever you're doing, have a great day, and we'll see you in the next video. Cheers.